I am from Coleo de Santa Lourdes of Leyte Foundation Incorporated, and I am from BSN 1A. So today, I'll be discussing with you the cardiovascular system. So I've chosen three topics or three of the circulatory system diseases, mainly the heart attack, the hypertension, and the stroke. So let's get into it. Heart attack. Approximately 7 million people around the world die every year, and cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. Like all muscles, the heart needs oxygen, and during a heart attack, it can get enough fat deposits or plaques develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages if one of the plaques ruptures or cracks. A blood clot will form around it in minutes, and partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or also known as heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood, as well its rhythm might be thrown off in the worst case scenario. A heart attack can cause a sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain, caused by the oxygen-deprived heart muscle. Patients describe it as crashing or vice-like. It can radiate to the left arm, the jaw, the back, and the abdomen. But it's not always as sudden as dramatic as it is in movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal, and surprisingly in many people, especially those with diabetes, which affects the nerves that carry pain. A heart attack may be silent. If you think that someone may be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open more extensive blockages. Might require coronary artery bypass surgery using a piece of vein or artery from another part of the body. Heart surgeons can reroute blood flow around the blockage. These procedures establish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect the risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training, A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which also lower your heart attack risk as well. And of course, medication can also help prevent the heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors like high blood pressure, cholesterol, and diabetes will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter. After all, go a long way in making sure your body's most important muscle keeps on beating. So that's it for the heart attack. Let's move on to the hypertension. What is hypertension? So basically, hypertension is one of the most prevalent chronic diseases in the world. So what does it mean when someone has hypertension? With hypertension, the patient consistently keeps suffering from a mean higher blood pressure as compared to the normal range. In other words, it means that the pressure of the blood in the arteries tends to remain higher than what it should be. When measured by a blood pressure monitor, the optimal normal blood pressure measurement is considered to be 120/80 mmHg, and the normal upper range of blood pressure is believed to be 135/90 mmHg. When a person shows blood pressure measurements that are higher than the normal upper range, then the person is said to have high blood pressure or hypertension. High blood pressure can prove to be lethal as it can affect normal heart functioning. It also can cause brain damage and can hamper normal kidney functions. So data suggests a shortened life expectancy in patients if proper treatment and management is not applied. Many different factors can contribute to the occurrence of the disease. It has been noted that about 90 to 95% of the people who have hypertension suffer from primary hypertension. The word primary hypertension implies that the hypertension is of unknown origin. Still, there are some factors that have not been found to contribute to the occurrence of the disease. The biggest one is obesity and weight gain. These play a major role in the development of hypertension. Obesity may account for 65 to 70% of the risk for the onset of hypertension in an individual. So sedentary lifestyles are lifestyles devoid of physical activity, and they has been termed as a leading cause for the development of hypertension in most patients. Junk food and high sodium intake is also a culprit. We are naturally adapted for the intake of 2.5 kg of salt per day, and usually the same amount of salt has to be excreted from the body. Hypertension can develop as a consequence of the body not being able to excrete sodium from its system properly. So most junk foods contain high quantities of sodium, which leads to increased sodium load in the body. Therefore, junk food should be avoided. Some other factors are diabetes, aging, emotional stress, and low potassium intake. These all also contribute to increasing the probability of developing hypertension. So now that we've learned a little bit about hypertension, that here are 3 ways on how you can manage it. First, a non-pharmacological approach does not involve medication. It mostly pertains to having an active lifestyle. The aim of such an active lifestyle is to promote weight loss in patients by increasing the physical activity. It also involves diet control and stress management. Reduced salt, alcohol, and tobacco consumption, and increased potassium and fiber intake are prescribed in this approach. The second approach is a pharmacological approach. In this one, specific drugs are used to control high blood pressure. Most patients find it hard to choose or to change their lifestyle. People get used to leading a specific way of life for so many years and prefer drugs instead of making a change in their daily routines, just like my father. So these drugs work by maintaining the blood pressure at normal levels so that injury to the different organs of the body can be avoided. And lastly, a combination of both pharmacological and non-pharmacological approaches can be used. This comprehensive hypertension management approach focuses on reducing the overall harmful effects of the disease by applying both lifestyle modifications and pharmacological interventions. So that's it for the hypertension. A stroke is when the brain doesn't get enough oxygen. The most common cause of a stroke is a blockage in the blood vessel to the brain, which is often due to a blood clot getting trapped where the blood vessel gets narrow. When the blood vessel gets blocked off, blood can no longer flow past the clot, and oxygen can get to the brain tissue, and that tissue quickly starts to die off. Sometimes, though that clot might dissolve on its own before there's permanent damage, and this is known as transient ischemic attack or TIAA, also known as a mini stroke, and symptoms typically go away on their own within a few hours. If a person is having a TIAA, they should still go to the hospital though, because it could be a warning sign that a larger stroke is about to happen. Now, knowing the signs and symptoms of a stroke can make a big difference in how quickly someone gets scared and in turn how well they recover. Remembering the word fast will help you remember the signs of a stroke. F. F stands for face because usually one side of the face starts to drop and becomes hard to move. This can sometimes cause someone to smile crookedly. The next letter is A. A is for arm weakness, or the inability to hold both arms out straight in front of the body. But it's not always just the arms. Sometimes a stroke can also cause weakness in the legs. S. S is for speech, which can either mean that someone's slurring their speech or having trouble understanding what others are saying. And finally, T is for time, because someone should call emergency services immediately when these symptoms appear. Now, strokes can also involve other symptoms, but these are the classic signs. So remember, face, the arm, the speech, and the time. So fast. A stroke should be treated within the first few hours to improve the chances of a good recovery. Now that there are treatments that can be offered in the first few hours of a stroke, after several hours have passed, these treatments will no longer work because the tissue can no longer be saved. PPA, sometimes known as the clot buster medicine, works by dissolving the blood clot and allowing blood to flow back through the previous clot vessel. In addition, there is also thrombectomy, which is a minimally invasive procedure that can be used to remove larger clots from the brain. Now, after the stroke, the main goal is to prevent another stroke. The most common modifiable risk factor for stroke is hypertension or high blood pressure. Lowering blood pressure back to the normal range can result in the greatest decrease in stroke risk. So next are smoking. which approximately doubles the risk of another stroke. But this additional stroke risk disappears within 2 to 4 years of quitting. It takes most people several attempts to quit before they're successful. So it's important not to be discouraged after a failed attempt. And there's diabetes, which is a disease that causes high blood sugar, which ultimately damages the blood vessels. And finally, there's high cholesterol, which can lead to the narrowing of blood vessels. All of these can predispose someone to having a stroke. But the good news is that they can all be reduced through a combination of lifestyle changes and medication.